you experiencing ringing, buzzing, or hissing sounds in your ears that won't go away? Did you know that a common issue like TMJ could cause your tinnitus to happen? If you're struggling with tinnitus, stay tuned. In this video, I'm going to explain how TMJ disorders and tinnitus are linked, why they might be affecting you, and what steps you can take to reduce both. By the end of this video, you will have a clear understanding of the connections between these two conditions, the science behind it, and practical solutions that can help you manage your tinnitus and TMJ symptoms. Hi, and welcome back to my channel. I am Shema, an ASHA-certified audiologist and tinnitus specialist and the author of Living with Tinnitus book. I do have high-pitched ringing sounds in my both ears, and it sounds like this. So this is what tinnitus sounds like for me, and I have been living with it for years. Today we are diving into a topic that affects many people but isn't always discussed enough, the connection between tinnitus and TMJ disorders. If you are dealing with persistent ringing in your ears or jaw pain, or if you ever wondered if there is a link between the two, then this video is for you. I will be breaking down the connection between tinnitus and TMJ, how they interact, and what you can do to find relief. Let's get started. First, let's start with the basics. Tinnitus is the perception of sound when no external sound is actually present. The most common symptom is a ringing in the ears, but it can also sound like buzzing, hissing, or even a high-pitched whistling. In my work as an audiologist, I have seen how tinnitus can deeply affect people's lives, causing stress, anxiety, and even depression in some cases. Now, there are many potential causes of tinnitus, ranging from ear infections, hearing loss, exposure to loud noise, and even stress. But what about TMJ issues? So TMJ stands for Temporomandibular Joint, which is the joint that connects your jaw to your skull. It is the hinge that allows you to talk, chew, and yawn. Problems with the TMJ can lead to TMJ disorders, which are often characterized by pain in the jaw, face, neck, or shoulders. Common symptoms of TMJ disorders include jaw pain or tenderness, especially when chewing. Clicking or popping sounds when you move your jaw are the other factors you would see. Difficulty opening your mouth fully, headaches, or earaches. These disorders can occur due to a variety of factors such as stress, jaw injury, teeth grinding, or poor posture. But here's where things get interesting. So, what is the connection between tinnitus and TMJ disorders? While we don't have all the answers yet, research suggests that there is indeed a link between the two, and it is something I have personally encountered many times in my practice. Here are a few reasons why they might be related. The TMJ and ear structures are closely linked via the same nerve pathways, particularly the trigeminal nerve, which supplies sensation to both the jaw and the ear. When there is dysfunction in the TMJ, it can cause irritation in these nerve pathways, which may lead to the perception of tinnitus. Muscle tension. TMJ disorders often involve tight or overactive jaw muscles, particularly the masseter and temporalis muscles. These muscles are close to the ears, and their tension can contribute to both ear pain and the perception of ringing in the ears. Additionally, teeth grinding or clenching, often associated with TMJ, can lead to an increase in tinnitus symptoms. TMJ issues are commonly exacerbated by stress, and the increased tension in the body can worsen both conditions, creating a cycle that is hard to break. I have seen many cases where individuals with TMJ disorders report a significant increase in tinnitus symptoms, and it is important to understand this connection so you can seek the right treatment. If you find this video helpful so far and want to see videos like this, don't forget to give it a thumbs up and hit that subscribe button to join our community. And make sure to turn on the notification bell so you never miss out a new video just like this. Now let's dig a little bit deeper into how TMJ issues can make tinnitus worse. So jaw clenching and teeth grinding are one of the most common behaviors associated with TMJ disorders. It can increase tension in the jaw muscles, which, as I mentioned earlier, are close to the ear. The more tension you have in these muscles, the more likely it is that tinnitus will become more noticeable and more intense. So many of my patients with tinnitus also report that they grind their teeth at night, which may contribute to both the severity of their tinnitus and TMJ pain. So the next one is jaw misalignment. If your jaw is misaligned, it can put uneven pressure on the TMJ and causing discomfort and pain. This misalignment can lead to an increase in the intensity of tinnitus, possibly because the abnormal jaw position creates more pressure on the surrounding muscles and nerves. And the third one is stress. So stress and anxiety can exacerbate both tinnitus and TMJ disorders. When you are stressed, you may clench your jaw without even realizing it, and this can make your tinnitus worse. Also, high levels of stress can make it harder to cope with the emotional toll of tinnitus, which can lead to a downward spiral of worsening your symptoms. Now that we understand the link between TMJ and tinnitus, you're probably wondering, what can I do to relieve both? Let's go over some effective strategies you can try. If you suspect your tinnitus is related to TMJ, addressing the TMJ disorders itself can reduce the severity of your tinnitus. Here are some things you can do. So practice relaxation exercises such as deep breathing, meditation, or yoga. Reducing your overall stress can lower jaw tension and in turn ease both TMJ pain and tinnitus. Gentle jaw exercises prescribed by a physical therapist can help improve jaw function and reduce pain. These exercises can also help alleviate muscle tension that contributes to your tinnitus. For those who grind their teeth at night, wearing a mouth guard can reduce the pressure on the TMJ and help minimize the impact on your tinnitus. Sound therapy is one of the most common treatments for tinnitus. Using external sounds like white noise, nature sounds, or specifically designed tinnitus masking sounds can help to reduce the perception of tinnitus. I often recommend these to my patients, especially those who also suffer from TMJ-related issues. These sounds can help distract from the internal ringing or buzzing and make it easier to focus on other things. Cognitive behavior therapy is a type of talk therapy that can help individuals manage the emotional impact of tinnitus. It teaches you how to change negative thoughts patterns that make tinnitus seem worse. For people dealing with both tinnitus and TMJ, this can be especially helpful as stress and anxiety are often the root cause of these both issues. If you have TMJ-related symptoms, consulting with a dentist who specializes in TMJ disorders can be very beneficial. They may recommend splints, align your bite, or even suggest Botox injections to relax the muscles around your jaw. These treatments can significantly improve both TMJ pain and tinnitus symptoms. To wrap up, the connection between tinnitus and TMJ disorders is real, and it's something that many people experience. Whether it's due to muscle tension, stress, or nerve irritation, understanding the link is the first step toward finding relief. If you are living with both tinnitus and TMJ pain, I encourage you to speak with an audiologist and dentist who specializes in TMJ. Together, they can help you find the most effective treatment plan tailored to your needs. If you found this video helpful, be sure to give it a thumbs up and share it with someone who might benefit. Leave a comment below if you have experienced tinnitus or TMJ issues and what strategies have worked for you. And don't forget to subscribe for more expert advice and tips on managing tinnitus and hearing health. I will see you in the next video.